lung nodule is basically a scar that formed in the lung by your body in a response to a prior non-bacterial infection the majority of the time. So it can't be attached to anything else. If it is attached to the lining of the lung or somewhere else, it's really not considered a nodule. Nodule is independent, and it's usually less than an inch in diameter. The most common sign is incidental finding, meaning that you've either had a CAT scan of your abdomen looking for gallbladder disease or appendicitis or colon disease, and it catches the bottom part of your lung, and then that would show up as a nodule, and then that triggers a consult to our pulmonary nodule clinic, which triggers a consult to one of the pulmonary physicians to address that nodule. The size has a factor, and your smoking history has a factor, and your occupational, if you had an asbestos exposure or chemical exposure at work. Do you work around any kind of animals? Have you had protein exposure to any of the animals? You worked on a ranch and you were using protein feeds for the steers. Chickens are notorious for this, so you could have an exposure to chicken droppings. That all skewers it towards maybe we need to consider this as a possible early malignancy. Usually the smaller size, those are almost always considered benign to start with. But if you have a smoking history or an exposure history, we would probably follow it up with CAT scan. Most of the nodules are small, and that makes it extremely difficult to try to biopsy and locate it and get an accurate biopsy on it. So most often we would tend just to follow it up with serial CAT scans of the chest, looking for a change in size. So if it doesn't change in size, that's good. If it gets smaller, that's better. If it gets bigger, that's not so good. Our next option would be to do additional studies, would be a PET scan, and that has an isotope that's attracted to both cancer cells and infectious cells. If the nodule lights up on a PET scan, then we could assume in the right setting, smoker, occupational exposure, that's most likely cancer. The next step would either be biopsy of the area if it's large enough, either with a CT-guided biopsy of the chest or with endoscopically using a robotic bronchoscope to try to biopsy it. For smokers, there's approval starting at age 50 up until age 79 for low-dose lung cancer screening. So those individuals, we also recommend routine screenings. If we have known patients in our practice that have had a significant smoking history, we routinely do yearly CAT scan screenings.